Hi, we're back with integrative physician Dr. Chris Calapai talking about heavy metal toxicity. Dr. Calapai, you've been treating a lot of patients with Parkinson's very successfully. What kind of metal toxicity are you finding in these patients?
We see a great deal of cadmium, lead, mercury. I think mercury is very common because of the fillings in the teeth. We see aluminum. It's almost like there's a smorgasbord of each of the metals.
I was going to say, not just any particular one.
Yeah, because of so much variability and so much exposure with people in all walks of life. I've never seen just one metal be elevated, and it's rarely that it's just one or a couple. Typically, we're seeing lots of all the metals now.
And just your treatment involves intravenous glutathione, right?
Correct.
Now, glutathione is a cellular detoxifier.
Great. It's the most important intracellular free radical scavenger. It is the greatest antioxidant for the brain. That's how we're made. In a brilliant study in 1996 in Italy, researchers took Parkinson's patients who had passed away, looked at their brains, saw the metals damaging the substantia nigra, where we make dopamine, and found there's no glutathione in the brain. So brilliantly, they said, well, why don't we just give glutathione to the patients who are living? As they did that 3 times a week for a month, they saw a 42% decline in their symptoms. And that was just blocking the metals with glutathione. Then my idea revolving around that, well, let's correct vitamins, minerals, correct hormones, do the exercise, and also use chelation to remove the metals. So our patients get better than a 42% improvement because you're taking away the thing that's causing the damage. And to make it even more fascinating, many of our patients have weaned back on their Parkinson's medications, but you can only do that if the brain's making dopamine again, and that's a fact.
Right. So is there any way that myself, for instance, can increase my glutathione production, my natural production? Is there a supplement I can take?
There are 2 supplements that can create some benefit. One of them is N-acetylcysteine. That can convert to a little bit of glutathione in your body. We tell people to take it every day. Is it going to reverse the Parkinson's or significant symptoms? No, but at least you'll have more glutathione available. You can also use curcumin, which comes from turmeric, the spice curry.
My favorite.
And that can hold the glutathione in your cells longer. So research has described that as well.
Okay, great. I know chelation therapy is part of their detox program. Explain to us what chelation is actually.
Well, chelation therapy has been around for many, many years. It's an intravenous treatment with a substance called EDTA. It's a protein that grabs onto and binds to heavy metals and doesn't let them go, and allows the body to move that out into the urine. The overview is that when we evaluate a patient, we'll do a blood test on their first visit for vitamins, minerals, absorption, hormones. We learn as much as we can about the body, and we're testing for heavy metals. But the blood test for heavy metals is a transient place for metals to be, but a transient place to see what's come in over the past month or so. Then we'll do a pre-chelation urine, where we get a little bit of urine to see if the metals are spilling. If they are, you have a lot in your body. And then we'll do a chelation, takes about 45 minutes, and then we collect a 24-hour urine sample. That will give us a huge response compared to just a little bit of blood that goes into the tube at the time of the drawing. So the 24-hour urine is the key way to know what metals are in your system.
Of course, that sounds like it's necessary for people who have late-stage disease like Parkinson's, but what about for people like myself who just want to detox?
Well, you'd be very surprised.
What about oral chelation? What about hyperbaric oxygen?
With just about every patient I see now, and have been for the past few years, we've been doing screening for heavy metals, and we see the metals coming up high in the blood. Then we'll recommend double-checking and do that urine, and then we see higher levels coming out in the urine. The big worry for me is that since we know the research says the metals are damaging, and lots of people have them, virtually everybody, and that the metals cause these diseases, everything from the cancers, neurologic problems, etc., glaucoma, cataracts. I don't want to wait until a person develops neurological symptoms to start looking for the metals and then removing them. So we test and we remove them in whatever amounts we find, and most people have a lot. There are benefits to the human brain, obviously, of oxygen. Hyperbaric oxygen, which I'm trained in, have a certificate in it, is a brilliant way to get pure oxygen into your cells. It kills germs, can help to treat or kill bacteria, viruses, Lyme disease, can help to reverse the damage to the brain from stroke. So it's a brilliant treatment. Yes, your brain needs oxygen. It needs vitamins, it needs minerals, hormones, but it also needs to get rid of those things that are the most damaging to the body, the heavy metals.
Right, but of course there's a concern, especially in these times, that chelation is not cheap. It may be covered for lead, but it's not necessarily covered for other metals, correct?
Well, we don't often find that there is no lead on board, because lead's a very common heavy metal. So when people come in and we test for all the metals and lead shows up, then chelation is a covered procedure for that. And we keep our fees as low as possible. We obviously go by Medicare's guidelines with charges for fees and such. Yes, we'll put people on some cilantro. We may recommend green products with chlorophyll. But all the people I've seen over the years that have used oral chelating agents, whether prescription or non, we still see huge amounts coming out when you do the intravenous treatment. The question is, with an oral product, how much are you absorbing? Even with vitamins, some people take 5 grams of vitamin C a day, but you don't see that reflected on their blood test. So the digestive defect may be inhibiting oral products from getting the best result. That's why the intravenous, which is 100% absorbed, gives you a better
I just wanted to bring up
result.
exercise and sweating because I'm going to be interviewing a physician on Long Island who's done detoxing for the 9/11 responders, and he's used saunas and heavy-duty exercise to help
An
sweat it out.
absolute benefit, but also remember, just as we don't use one protocol to treat anything, we would recommend testing for vitamins, correcting vitamins and minerals, block the heavy metals, use some of the glutathione, the N-acetylcysteine. Sweating and detoxing and saunas do work.
I'm
but I
afraid
think
we're
we
out
have
of
to
time.
add, we have to add a few things to it.
All right, great. Thank you so much for coming.
My pleasure.
All right. Thank you for joining me. I'm sorry we're out of time. Remember to tune in each Monday for my weekly reports on natural health and alternative medicine. I'm Mary Musi. Enjoy the rest of your weekend.